Critics are describing it as a failure of the healthcare system and demanding the Ford government pay attention to these numbers. Last year, emergency room wait times got so bad that almost 300,000 patients gave up and left untreated.
This is an enormous number. Our hospitals are full to the brim.
Dire new findings in a report by a public policy think tank titled "Too Many Canadians Are Leaving Emergency Rooms Untreated." It is a Canada-wide problem, but in Ontario alone, 695,000 patients left the ER without treatment last year. That represents almost 5% of the 6 million ER visits in 2024. It is a 31% increase since 2019.
Every Ontario taxpayer is paying for access to a family doctor and access to healthcare when they need it, especially in those moments where minutes matter, where lives are on the line. And the reality is that under this government, they are not getting that.
But the Minister of Health's office tells us it is making record investments in the healthcare system and leading the country with some of the shortest wait times for emergency care and critical surgeries, the highest number of people connected to a regular primary care provider, and the largest healthcare workforce. But 2.5 million Ontarians remain without a family doctor, and critics say more physicians could help relieve the burden on hospitals. Just this week, doctors did get a boost.
It is a significant increase and it is a positive step forward.
In a new 4-year agreement with the government, Ontario doctors will see a 7.3% bump over the next 3 years. That's on top of a 10% pay increase in the first year of the agreement. Also key, family doctors will get compensation for administrative work. Do you think this will help with retention and recruitment efforts?
Absolutely. I think that it's going to make a difference in terms of people who are already in practice wanting to stay in practice, and also for the new grads. And now we're hoping that they'll see that it's a very financially viable and sustainable model for them to practice in.
The Ministry of Health also said that the new agreement includes investments that will incentivize family doctors to take on new patients. They also said some of their policy changes, like granting pharmacists more powers, will alleviate the pressure on emergency departments. For City News, I'm Tina Yazdani.